Hi, my name is Deepa and my topic is Can Information Technology Really Save Healthcare? Okay, what is IT? Information technology is the use of computer software and hardware to collect, store, retrieve, and transfer information and data electronically. And how can IT be used in healthcare? In 1991, Institute of Medicine of the National Academics, also known as IOM, was asked to identify the strategies for improving healthcare. They found that information technology is integral to achieve the quality improvement in healthcare. Secondly, it is also used in clinics for prescription fulfillment, computerized provider order entry, also known as CPOE for drugs, lab tests, and infrastructure such as desktops, laptops, servers, and networks. It is used for billing, payroll patient registration, and accounting purposes by the administrative department. And why would you want to implement IT? Filling out tons of paperwork before seeing a doctor is a hassle and time consuming. So if a patient needs to change a doctor, then the whole copy of the medical records needs to be transferred. The new doctor needs to have access to all the records of the previous conditions, test results, and treatments that is important for the patient's continuity of care. And studies also have shown that a number of deaths are occurred by not having access to the patient's previous medical information. There is also the financial perspective that the patient would not want to do the same medical test if a documentation or proof would suffice, and with paper records, that is most unlikely because either the patient or the hospital may misplace the records. There are also a lot of medical errors due to illegible handwriting and incomplete documents. And the adoption of IT in healthcare has improved the quality and safety of the patients by 55%, and serious medication errors have been significantly reduced. Okay, and how can we implement IT? The AHRQ, the Agency for Healthcare Research and Quality, is working diligently on developing the IT initiatives. Further research and evidence will guide future IT implementation to improve the healthcare delivery around the world. The Medication Errors Reduction Act of 2001, introduced to the Senate by Senators Graham and Snowe, has now also been introduced to the House of Representatives Huckton and Thurman. This proposal would provide nearly $1 billion of funding over 10 years for hospitals and skilled nursing facilities to purchase information technology to improve medication safety. Another bill, the Health Information and Quality Improvement Act of 2001, would provide $420 million to help hospitals develop and use information technology that can reduce the frequency of medical errors. Now, how far will IT go? Electronic health records facilitate fast and accurate access to patient records, which improves diagnosis and patient monitoring. In the end, cloud computing can also transform patient care, clinical, and IT workflows and increase efficiency across healthcare organizations. In conclusion, I would like to say that with all these uses of IT in healthcare, I think applying IT to healthcare solution would really benefit patients and providers alike with efficient workflow and reduced healthcare costs. For example, in France, they use smart cards, which are plastic credit cards that have all essentials of healthcare, medical records, and reimbursement.